So you're aware I usually start with our indicators, and that's where we'll start today. So as of today, we have 15,585 confirmed COVID cases that have been identified in Buncombe County since the first case. 293 COVID deaths have occurred in our community. And currently, we are seeing about 68 new cases per day on average enter our public health workflow. This is remaining stable for the third week. It's been fluctuating around 65 to about 68 or 69. Our new cases per 100,000 per week as of today is 178. Our Epi Curve, just wanted to show this again to you all, that clearly there's that holiday surge that we're coming out of, and the Epi Curve is showing some stability over the last few weeks with new cases mirroring pre-surge, but not quite as low as what we had experienced back in the summer. And if you'll remember, around July and throughout the summer, we were seeing increased incidence of cases, and that felt like a heavy burden then, but comparatively, you can see that quite small compared to what we just came through, and we haven't quite reached those summer levels yet. Our percent positivity is currently and remains 3.4. That has been stable for the last couple of days. And regional hospitalizations, mind you, this is the 18-county region. Dr. Hathaway is here with us today and can give you more information about our local hospital system. But regionally, the hospitalizations also continue to show a steady and consistent decline over the last several weeks. The last few days showing a bit of stabilization. And then this is our table of metrics. The table hasn't changed significantly in the last week. There was a slight bump in new cases per 100,000 that actually might be indicative of that stabilization because it didn't increase very much. But the percent positivity remains quite low and is below the 5%, which is desirable. The testing data here has returned back to pre-surge levels. It remains really high, but is returning to pre-surge, which during the surge, that was as much as 10,000 tests per week. And now we're seeing that come back down anywhere in the mid-6,000s to 7,000s. And then our COVID deaths per 100,000 population per week did see a significant decline. And again, I always tell you all that's based on a really small data set, so that can swing from one week to another. And then our percent inpatient hospital beds occupied by COVID-19 continues to go down, and our ICU beds occupied by COVID-19 is also still favorable. So our trends are indicative of progress in reducing the spread of COVID-19, but in order to continue to see these trends stay or continue to decline, then we have to continue to do the 3 W's. Vaccine rollout, while is continuing, and we're working down that wait list and getting more people vaccinated, it's still not enough for us to stop doing all the things that matter. So it is important for folks to continue to wear their masks, wash their hands, stay 6 feet apart, and limit your interactions as much as possible. So please do your part to help us fight COVID-19. So as a reminder, North Carolina is currently vaccinating groups 1 and 2, and as of February 24th, school and child care staff became eligible as the first group of Group 3 frontline essential workers. We are coming in right after the governor's briefing, and so the announcement was made that beginning tomorrow, the additional frontline essential workers will be eligible beginning tomorrow. That was initially March 10th. We will not be ready to open tomorrow. We had already scheduled updates and testing of our surge capacity with the anticipation of March 10th, and we're going to be testing out that surge capacity because we know that Group 3 was coming, and the updates to the wait list, particularly how someone can get off the wait list. So we will be meeting as a team tomorrow to discuss the progress of those updates and that testing of the surge, and then determine when we can open. So this is just a summary as of yesterday. All of these numbers are as of yesterday. Our state had administered over 2.2 million total doses, with 1.4 million being first doses in arms. Among all Buncombe County vaccine providers, over 56,000 total doses have gone into arms, and about 63% of those are first doses. And then Buncombe County HHS and our partners at Emergency Services have administered over 32,000 total doses since beginning our efforts on December 22nd, and over 20,000 of those are first doses, with almost 12,000 being second doses. And I did want to share this as we talk about the equitable distribution of vaccine. And we've been tracking our efforts specifically as health department. And what you see here is Buncombe County HHS specific. Of the total county population, that first area, of the total county population, 2,309,000, about 91% of our total population is white or identifies as white. And that total population, that total white population that is 65 years and older, is estimated to be about almost 52,000. Of that group, so the percent white and over and 65 years and older that we have given a first dose to, we've reached about almost 26% when we look at that based on the numbers that we've given out. And so of the total population here in Buncombe County, about 6% is Black or African American, which is about 15,000. When we looked at the age breakdown, we estimated that roughly 2,260 individuals are African American and 65 years and older. And through our vaccine operations, we've reached about 22.2% of that that are African American and 65 years and older, so a little over 500 individuals. So a little over 13,000 in the white population, a little over 500 in the Black and over 65 population, which is about 22% of what is estimated in that age band. And we did use the Office of State Budget and Management demography estimates for this information. Unfortunately, that same group does not collate the ethnicity data in the same way that it does for the racial data, and so there isn't the same age banding for that group. But we do have the total population information, which is roughly 10%. And of the doses, first doses we've given out, we've given out about 1.4% to those who identify as Latinx. And so given that you've heard me say this before, given that the Latinx population across the state in general skews a bit young, we knew that there was going to need to be a lot of intentionality. And also with our African American population too, with access and making sure that we're intentional in reaching an equitable distribution. And so, but that particularly the Latinx one does remind us that we continue to need to continue to be mindful and intentional and be planning for that. So more to come on another slide about some of that. And our current baseline allocation is 2,340. This is still 2 trays of Pfizer as our baseline. It may seem like an increase, and I think I explained this earlier, that previously it was based on 5 doses per vial. Now it's standard to base it on 6 doses per vial, so that's why you see 2,340 now. This was our baseline for last week. It's our baseline for this week. It will be our baseline for next week. And then sometime next week, we'll start to see the 3-week projection going for the next 3 weeks. In addition to the baseline, we did receive what North Carolina DHHS calls the equity bump for the same 3 weeks. The intent of these doses is to provide access in addition to your baseline to historically marginalized populations. And last week, we partnered with Tridestone Missionary Baptist Church and Western Carolina University and others to administer over 280 doses And this week we are partnering with Haywood Street to vaccinate our homeless and other recipients of services there, and expecting to administer roughly 150 doses at that event. And then for next week, to be completely determined as we're still planning, is to have some Latinx outreach with that equity bump as well, and integrate that into our existing fixed operations at AB Tech. So more to come on that one. And then added, in addition to our baseline, we continue to accept transfers from local partners. Last week, we accepted about 300 doses from our partner at Mission Hospital. This week, we're accepting a little over 500 doses from our partner Mayhec, and possibly additional doses next week. And then all transferred doses are applied to our wait list. We did begin vaccinating the school staff using the set-aside. That began last Saturday, February 27th. And as a reminder, that was one tray of our baseline that we designated for that group. And we vaccinated about 500 last Saturday. And as an update, once the lists were submitted from our schools, we were expecting the highest number we were expecting was around 7,000 to be on those lists. What we got back was about a little over 4,100, so it's about 67% uptake in that group. And given that we are going to be doing a set aside of about 1,000 doses a week, we think about 4 weeks we'll have that group completed. And then our partners at Mayhec are assisting with vaccinating the child care staff. We anticipated that group to be as much as 1,100, and what we see right now is about 670 signed up, so about an uptake of about 60% with that group.
Stacy, could you go back for 1 second?
Sure.
So we're getting 500 doses transferred from Mayhec to County Health this week. Is that expected to be like a one-time thing, or?
Most transfers are only seen as one moment in time, and not to be counted on the following week, but all of those doses would be incorporated into our efforts to get our wait list down, our general population wait list, and so we'll be adding appointments to our schedule and getting folks in those.
Okay, so I'm just trying to kind of add this up. So if our baseline's 2,300, and then we got 300 equity, 300, and 500 from Mayhec. What's the total number Buncombe County is going to have for the coming week?
So for this week, you'll have the 2640, about 2,600, 2640. That is our regular allocation, and then another 500, so a little over 3,000, pending any other transfers or other developments.
Okay, thanks.
And then again, 1,000 of that set aside.
I feel like I should ask. Go ahead, Al.
Along those lines, if you get the 500 for next week and we give the first shot, but you aren't guaranteed the second shot?
No, if you accept a transfer, the agreement is when you accept a transfer for those doses, the provider who transferred those to you and you accepted them must give you the second dose.
Oh, good. Okay, thanks.
And Stacey, I was going to ask, just on the Mayhec front, is that 500 in addition to their own vaccination program that they're?
That's right. I believe they unexpectedly got another, an allocation, and have been partnering with us to transfer some of that over to our site.
Okay.
Stacey, I have a question about the wait list. I think when I looked at it yesterday, it was about 54,000. Do you have any anecdotal information about when those calls are being made to schedule appointments? Any idea of how many folks have gone elsewhere, to another county, to another state? I just wonder, like, when we look at 54,000, how accurate is that?
Thanks for that question. So that's part of what we're working on too, is looking through that wait list for any duplicates. I will tell you, I don't have a concrete number for you. I can tell you anecdotally, as we do call folks, they are saying, oh, thanks, I got it somewhere else. And we say thank you, and we keep going. We do get emails and calls from folks who want to come off the wait list, and you can call us at the 419-0095 or ready@buncombecounty.org and tell us that you want off the wait list. We are looking through that to see if there are any duplicates. We do recognize that folks signed up several times, and we want to, give them their highest number and then clean that up a little bit. So that's in the process. And so you will continue to see that higher cumulative number because we don't want that to change. Because if we clean it up and say, all right, now we really only have about 30-some thousand left, but we change that number. If your number 54,000 and we change that number, you might think that we've deleted you. So that number is going to stay while we still clean up. We are scheduling currently around the 17,000s, and that was as of last week's update. And so that gets updated every Wednesday, so you'll see that number change. I suspect we'll be closer to the 20,000s at that point. And then to your question about when are people getting scheduled. So typically when we see our allocation come in and we can confirm it, we start scheduling folks for those appointments that we know we're going to have part of as part of our baseline. Now, when we accept a transfer and those types of things, when the transfer is, it doesn't even have to be complete. When we have initiated it and we've confirmed it, we can open up appointments with the expectation that the transfer will happen probably within 24 to 48 hours.
Thank you.
Mm-hmm. And I did want to remind folks that we do have additional vaccine providers in our community. Hospitals and local health departments were the first brought on board, and since then, our community health centers, our FQHCs have been brought on board. We also have commercial pharmacies like Walgreens that are participating in the federal program, and we have 8, to my knowledge, in Buncombe County who initially received about 100 doses per week. It is my understanding that their federal allocation is going to increase. I do not know for sure by how much. But we do have Walgreens operating in Buncombe County that have doses as well. We have heard from other folks that they are getting appointments through other providers, including Walgreens. And so this is great news for access. And if folks are interested in learning more about other vaccine providers, they can go to myspot.nc.gov and they can put in their zip code and find a list of providers in their area that are approved for vaccine and are giving out vaccine. And so with that, I think my next slide is about vaccine updates, and I'll turn it over to Dr. Hathaway now because I think your slides are after this, and Dr. Hathaway can speak to our recent vaccine developments with J&J or Johnson & Johnson, and then we'll be followed by Fletch with the executive order updates.
Thank you, Stacy. I appreciate the opportunity once again to be here. I want to preface my comments by extending my sincere thanks to the county in general, especially Ms. Pinder and Stacy and her staff, Dr. Mullendor, when she was wearing 2 hats. You know, when I look back and think about the first press conference we did here, it was just about a year ago today, and we were, we knew everybody's name who had COVID in our community. It's amazing the things that have happened and have changed, and it's nothing that I think any of us would have wished for or wanted to go through. But in life, we're often given things that we don't expect, and it's our job to make lemonades out of the lemons. And I think we've done that, and one of the full cups of lemonade that I've been able to drink has been the shared partnership with the county and other health providers in the region. And it's sad that it takes events like this at the human toll to bring us closer together. But I think my real sincere thanks to everybody who's participated in the partnership. And I think as you're seeing, as we talk about COVID, it just in our day-to-day conversations, the partnership is exemplified. And I know that as we come through the pandemic this next year and into 2022, that those new relationships will serve all of us in our community really quite well. So it's a really sincere thanks to you all for all you've done. We do have a new vaccine that's on the way. It's the J&J vaccine. It is different than the Moderna and the Pfizer vaccines in 2 very important ways. Number 1 is that it's a single injection, so you don't have to come back for a second shot. And number 2 is that the storage requirements are a little less stringent in terms of deep cold refrigeration, so it should be more easy for us to have it more widely available as supply comes. The supply will be limited. We're only going to get about 4 million doses shortly and 20 million by the end of March throughout the country. And so it'll take a while for it to ramp up, but we are getting some. We're getting between 70 and 80,000 doses in North Carolina this week. We, Mission Health HCA, applied on behalf of the 18-county region. One of the collaborations that has come from this effort has been a vaccine consortium that includes most of the providers in the region who are administering vaccine on weekly calls to understand where the capacity lies and where the vaccine stores lie, and we match those up with demand, trying to make sure that we get the vaccine out in an equitable fashion. And that's how the MAHEC transfers to the county have occurred, and our transfers to the county and other places throughout the 18-county region. And so we don't know exactly, we're just getting our shipment. We just heard for sure we'd get the shipment over the weekend, and we're planning on how to distribute those 7,000 doses of the J&J throughout the region. I got asked the other day whether this was a game changer, and I wish it were a game changer. 7,000 doses is a drop in the bucket compared to the million people in our 18-county region that we need to vaccinate, but it certainly is more light. The light's getting a little bit brighter at the end of the tunnel. I want to just have a few comments, maybe as an educational form, if I can take the opportunity. I won't take up too much of your time, but to amplify some of the comments that Ms. Saunders made. If you look at the United States, what struck me has been the heterogeneity with which COVID has affected our country. And what's really striking on this map, if you look at it closely, red is bad, green is good in terms of numbers of cases in different areas. And it has not been a disease which has affected us uniformly across the country. And perhaps most striking is the fact that just based on the colors alone, you can look at state lines and figure out which states had which public policies and how they impacted people. And that was very striking to me, that it's not just a biological phenomenon, it's a sociologic phenomenon that's affected our country. And I blew up Western North Carolina as part of this so that you can see that our little 18-county region in the center of that blow-up is green. And that is in large part due to two things. Number one is our relative geographic isolation, but it's also due to the proactivity that the county took in terms of the measures back last year, and the proactivity that you've maintained in terms of social distancing, insistence on mask wearing, and the like. And so I offer my thanks to you for that. This is a real graphic example of the benefit of us all working together to protect our community. So thank you. These are the cases in the United States. It looks almost exactly like the Epi Curve that Ms. Saunders showed about Buncombe County. And I pointed out to show that we are seeing a rapid decline in cases across the country. But look very, very closely at the bottom, at the far right end of this graph, and you'll see it's flattening out and rising just a little bit. And what you'll notice about all the other upward slopes on the graph is that they're preceded by a downward slope and then another upward slope. And so I'm worried, very, very worried. I remain concerned that we're going to see another rise in cases. And so I want to amplify Ms. Saunders' comments that we need to be diligent to the 3 Ws. We're down, we're much better off than we used to be, but we're not out of the woods by any stretch of the imagination. These are the cases at Mission Hospital, actually Mission Health System across all our hospitals in the region. It looks like the exact same shape of the curve. The blue line is total hospitalizations. The orange line is patients in the ICU, and the gray line is patients on ventilators. We peaked in January at Mission Hospital, about 138 patients in the hospital. We're down to 30 today. So dramatic drop. We're very grateful for that. But at the same time, we've seen 299 deaths. And I bring that up to remind people of the seriousness of this disease. And it affects, while it affects older people disproportionately, it affects young people too. And we had a death of a 19-year-old App State student earlier this year. The benefit of our vaccine program in terms of protecting the elderly is shown in this graph. And just very briefly, the orange curve is deaths among nursing home residents as a percentage compared to all deaths from COVID. And you can see that when we started the vaccine program at the end of December and January, and we targeted nursing home residents, the most vulnerable in our society, the percent of all COVID deaths in that population dropped off dramatically. So I want to use this to encourage the populace, the people watching this, to recognize that the vaccine is safe and effective and works. Just a few more slides before I finish up here. Stacy did a very nice job of pointing out what a wonderful job the county has done in terms of targeting minority populations. This is data from across the state, and I apologize for getting geeky with my data, but just indulge me for a moment, please. The dark blue bar is the percent of the population that is of that racial group. The orange bar is the percent of the total cases that had COVID. The dark gray bar is the percent who were hospitalized, and then the light gray bar is the percent who have gotten vaccinations. In a perfectly just world where the virus affected everyone equally and we got all that same kind of health care and we got vaccinations the same way, every bar would be equal. For African Americans, you'd be 21% of the population, 21% of the cases, 21% of the hospitalizations, and 21% of the vaccinations. That's not the way it is. Right now in North Carolina, it's 21% of the cases, 34% of the total hospitalizations, and only 15% of the vaccinations. The county's doing a better job at that, and I commend them for that, and we're working hard to vaccinate people who are disadvantaged, but we have a ways to go, and I just wanted to use this forum to point that out. And then last but not least, there's been a lot of talk, I mean, you can't, I got to pander to the public here with a slide with dogs in it, if you don't mind. Lots of talk about why we're worried about an upward rise, and the variant term has come up. And so I wanted to take just a brief second to let people know exactly why we're worried about variants. Variants are SARS viruses that are very similar but slightly different than the original strain, and they have a change in their genetic coding, that RNA. And the reason we're worried about it is because it can change the antigenicity, the virulence, and the transmissibility. Well, what does that mean? It means, can we fight it off? Will we develop antibodies that will fight it off? Number two, will it make us sicker than the regular virus does? And number three, how easily is it spread among all of us? And different variants can lead to different effects that way, and that's what has us most concerned. The analogy that I picked here for a talk earlier this week was that if you think of dogs and viruses as being equivalent, and the sporting group in dogs being equivalent to the coronaviruses, and Labrador retrievers being equivalent to the SARS-CoV-2, variants would be different colored Labrador retrievers. So they're very similar, they're slightly different, and that difference changes the way they behave and how we have to combat them. So that's why we're concerned. New variants are coming. I think the vaccines will be effective against them. Data suggests that they are right now, and where they're not, we can tweak our vaccines moving forward. Thanks, and I appreciate the indulgence, and happy to take any questions if I can.
I just one question, and Dr. Hathaway, you could field it, or Stacy, or whoever would like to. One of the metrics that we track is the number of cases per 100,000 in our county. And while a lot of the numbers, a lot of the metrics have really improved since early January, that's one that remains, orange or not in a green spot. But as part of that, is it correct to think about that is that we are doing a lot more as a community and a country in terms of testing now than we were, say, 6 months ago or 3 months ago. And the amount of testing that's done does influence that. While testing is good, the more you test, the more you're going to find per 100,000. So I just wanted to ask that question to kind of put into context as we look at that particular metric, what that all means together.
Yeah, and I'll let Stacy comment if she wants to. In addition, I think that metric can't be looked at in isolation. It also has to be looked at the percent positivity. So for me, the percent positivity is a little bit more important because, it takes into account how many people you're actually testing. I don't know, Stacy, if you have additional comments.
Totally on the right track that, the percent positivity, so the new cases per 100,000 per week really literally does look at the 7 days and how many new cases came in during that time, right? Mm-hmm. And so we've seen that reduced by over almost 60% since the new year, so that's good news. The percent positivity has declined as well, yet our testing numbers are still quite high. So I liken it to if you were doing 10,000 tests and your percent positivity is 3%, you're going to still have a high number of folks coming in. And so even though our testing numbers have come down and are stabilizing pre-surge, even pre-surge, we were doing a lot of testing. So we've done a really good job as a community saying we have access, we have opportunity. If you have symptoms, if you think that you've been in contact with someone who has COVID, come get tested. And what we're finding is still, with our decreased percent positivity, we're still going to have a high level of new cases. Now, when we look at our new cases per day, which is where that Epi Curve kind of comes in too, because that's based on specimen collection date, and it's reported two ways. What I show you all is more traditional Epi style, which is by specimen collection date, but it's also shown in the same way as when reported, or when it comes in. And so when you look at that per day, that new cases per day, that's where we're seeing that 66 to 68 new cases per day on average, whereas back in the surge of what we thought was a surge in the summer, that was 40-something. And so we're still, that is coming down exponentially from what it was at the time of the holiday surge, but still at high levels. We still have community transmission. This is why it's really important that you have to look at all of this together, because while our percent positivity continues to go down, and it is under 5, we still have transmission out there.
Okay, thank you. Commissioners, any other questions for Dr. Hathaway or Stacy? Fletch is going to talk to us as well, but any other questions for now?
I had 2 questions, I guess, for Stacy that you can answer now or later, I guess. But the first was around that demographic slide, which I thought was outstandingly helpful to give us a picture of how we're doing on the demographics side of things. I was wondering, in maybe a couple meetings from now, if you could include the, in terms of age, folks that are 75 years of age and older, or even 80, if that's possible with the data set you're using.
We do. So we already have it age banded from
Okay.
65 to 74, and then 75 and
Okay.
older. I don't have it past that.
Gotcha.
I did combine it this time because it matches the group that we're in, but we
Right.
actually do look at it stratified, and I can do that for you.
That'd be great, because I guess I'm just generally worried about the older, the oldest population and their access and internet availability and that sort of thing. So
Sure.
that would be great. And then I'm just curious from any of you around Group 3, with Group 3 opening up in the next week or so, or whatever, it's getting a lot more complicated in terms of the categories and employers and that type of thing. And I just didn't know if you had any, off the top of your head, thoughts that you'd like the public to know around that challenge on your end, and expectations they should have for signing up and qualifying under their employment status and that sort of thing.
So I can't speak for all vaccine providers, but I can tell you for us in particular that one of the things that the state has done, and this is regardless where you live in the state, you can go. I had shown a slide of my spot in .nc.gov where you can find a vaccine provider. There is a separate one about Find My Group, that if you just Google Find My Group, North Carolina, it will come up, because I hesitate saying the website and not getting it right, but we will get that out to folks, and I'll be sure it's in the press release too. That you can go to that website, answer some simple questions about what age are you, what kind of work do you do, and it will tell you what group you're going to be in. So that's the first thing that folks can do. Like if you're not sure, that's one of the easiest tools that's out there. So if you do find that you're in Group 3, frontline essential workers that are going to be eligible beginning tomorrow, please know that we had things planned and we are working as quickly as we can to get that wait list to accommodate Group 3. But what you can expect is when we open it, after we've tested the new upgrades and tested the surge, when we open it, you'll follow the same process. You can call in, or you can go to the online or the website and put yourself on the wait list. You will like I said, it's best to go ahead and make sure that you're eligible for that group. It's a great practice just to go and see where do you fall, because you might think that you are group 5 and you actually might work in one of the 8 sectors. That's one of the criteria, and you might be in group 3. Or you might feel the very opposite, which is you might feel like you're an frontline essential worker, but based on the state's first criteria, which is, are you in person? Like the number 1 is, are you in person? And then, are you in one of these 8 sectors? And all of those 8 sectors are listed on that site too. You might think that you're one of those and then find out you're actually in group 4 or 5. So it's good to know. So that's the first thing I would tell folks to do. But once we open it up, our wait list to that group, it'll be the same process of calling in or going online.
Thank you. Then it looks like findmygroup.nc.gov.
Thank you.
Yeah, thank you.
Good afternoon. Just want to give a quick update on our new baseline executive order, number 195 from Governor Cooper. Went into effect last Friday, the 26th at 5 p.m. and is scheduled to remain in effect until Friday, March 26th. Just going to hit some of the highlights of the more immediate changes for us. It did remove the safer at home curfew, which was the 10 p.m. curfew for everyone not an essential business. It allowed alcohol sales, on-site alcohol sales, to remain in effect until 11. So now that curfew for alcohol sales is 11 to 7 a.m. Mass gathering limits went back to where they previously were for 25 indoor and 50 outdoor. One of the biggest changes is that bars are now open. If you guys recall, they've been one of the few industries that have been remained closed its entirety of this response. They're now allowed to open up to 30% capacity and not to exceed 250 people. And of note that their operations must be seated. And there is also, as always, the caveat that they must allow 6 feet between groups of patrons, and that's going to really be there. I think for a lot of bars in this area, they're a limiting factor, not that percent capacity or the number, but allowing 6 feet between parties. Large indoor venues of more than 5,000 may operate at 15% capacity, and smaller arenas and stadiums may operate at 30% capacity. Those are the highlights. There are some smaller changes to language, but these are the things that significantly affect restrictions.
All right, thank you, Fletcher. Is there anything else on the COVID and vaccination?
I just wanted to promote for as we step in the phase 3 of our COVID vaccination priority groups, that anyone who's interested in receiving alerts of when that comes online or information, and text BC alert to 99411. And they'll see those notifications coming from the 419-0095 number. But that's a really good tool to stay informed of the vaccine operations. BC alert to 99411.
It's the only other question I have about the vaccines is, do we have a way? So in one of the earlier slides that Stacy showed, it was the total number of vaccines that we believe have been administered by all vaccine distributors or administrators in the county. Will we have a way to continue to track that going forward? So like, Walgreens is getting supplies as others get it. Will we have a way of being aware of how many they're receiving on a weekly or some time basis?
So the numbers that you saw up there are based on the North Carolina DHHS dashboard that shows that for the county as a whole. And so that would include vaccine providers that are receiving allocation and administering. As far as we do get notification each week about new providers or new providers that are being enrolled. And so it'll be, it's sort of, the list is set up in who's been accepted and enrolled and can receive allocation versus folks who have started the process but may not be approved and may not be able to receive allocation yet. And so we can see as new providers come into our community, it's not, there's not a great way to know exactly how much all of those folks are going to be getting each week. If they're part of the North Carolina system, we can typically find out because we're a part of the collaborative and consortium together, and we talk to each other. Those enrolled in the federal program, a lot of our information comes from our state partners when we have updates. and when they release information about those federal programs. So I don't always get the information, I don't get that specifically for every Walgreens. It's more of a general notification that we get from our partners at the state that says, in your community, there's going to be this resource, and in general, they're all going to get this much. But the numbers you saw up there are going to be consistent as the dashboard has that information. And over time, the state, may include more information on the dashboard than what it does right now.
Okay. So yeah, not going down to the level of like a single store, but do you think that, for example, we will, or you would be able to see how many like Walgreens in Buncombe County are receiving on a weekly basis, or is that still a little unclear at this
So
point?
typically what happens is the state will inform us when it's something like the federal program that Walgreens and CVS participates in. The state will say to local health departments, to other vaccine providers, this resource is coming. This many stores will be participating. This many are in your community, and we anticipate that they'll get this much. But that is a federal vaccine program, so the state only knows that much. And so if anything like that were to happen again, I would anticipate the same precedent of we would be notified, we would know how many in the state, how many in our community, and roughly how many doses they were getting. If providers are participating in the state program, which we are, and our hospital partner, and our community health centers, and other groups, then as the consortium, and we typically, as part of our allocation notification, we can see our other partners and how much they're getting from week to week.
Okay. Well, great. I mean, to the extent that it's feasible, of course, we're all very curious about how that overall supply is working out, especially as it gets more diversified. So please keep us posted on that so we can have a sense for sort of how the overall process is happening as it's, increasingly not just, a small number of the county and other key people who've been involved in it delivering all this. So thank you so much. Are there any other questions for now? All right.
Very, very quick, thank you all so much for the presentations. Just a request to staff, maybe at an upcoming briefing, if we could get an update on the emergency aid assistance and the status of the different types of, mic is off.
I'm muted, yes. The different types of aid and what's available and how those processes are going, that would be great. Thank you.
I will circle back and see where folks are on that. Thank you.
All right.
I'm sorry. Okay, great. Thank you.
All right. Thank you again, Dr. Hathaway and Fletcher. Appreciate all your work and everyone on your teams. All right. The next item